Welcome to the Flight Club Podcast, a woman's guide to leaning out. We give you a behind-the-scenes look at business launch and growth through the stories of successful female entrepreneurs. Here's your host, Felina Hansen, founder and CEO of Hera Hub.
Hello and welcome. I am looking forward to my conversation today with Dr. Patty Michelle, who is a mom, a writer, and public health specialist who combines her passions for public health, women's rights, technology, science, and the world to inspire children and adults through her writing. Her writing also draws on her more than 20 years of work across more than 40 countries in Africa, Asia, and Latin America. Patty holds a PhD in public health and policy from the London School of Hygiene and Tropical Medicine and a master's in health science and international health from Johns Hopkins School of Public Health. Welcome to the show today, Patty.
Thanks, Felina. It's wonderful to be here.
Yeah, I'm excited to share your story. You have had quite a career path and you're up to some really cool things with the work you're doing, the writing you're doing currently as well. So let's go back. I know you're originally from the Northeast, New York, New Jersey area. Take us along your journey. What was that decision when you decided to do your undergrad? How did you make those choices, those early education decisions? And then we'll get into, of course, your career path.
Sure. Thanks, Felina. And it's a real thrill to be here. I've actually been a member of Hera Hub DC since it opened, and really appreciate what you've created in terms of community for women. And so and it's been wonderful. So my journey began in New York and New Jersey, as you mentioned, and I was born to Egyptian immigrants who had immigrated to the US in the 1960s. And the reason that I think it's worth mentioning my parents is that my dad had really wanted to work with computers. And so he applied for immigration to any country where he thought he could work with computers. And the United States was the first country to come through. And he came to the US on his first day looking for a job in New York City, got a job in data processing, and had a fantastic career. Went back to Egypt, married my mom. She came to the United States, was quite young. Between my older sister, between me and my younger sister, she decided that she did not want to be a stay-at-home mom. So my dad encouraged her to do her degree in computer programming. And so she has a background in technology and worked on computer programming for the finance industry in New York in the 1980s. And all of that context to just say that a lot of my career has been very strongly influenced by my parents' work in technology. And so growing up, I was really good at math and science. I went to an all-girls school in New Jersey, Oak Knoll. And although I was very, very shy and very quiet, going to an all-girls high school really helped me come out of my shell. And I had amazing, amazing science teachers while I was there who very strongly encouraged me to lean into my love of science and also to lean into my desire to help people. And so I was, as an immigrant child, good at science, maybe she should become a medical doctor. And so that's the direction that I went in. And so I did my undergraduate at Johns Hopkins. And while I was there, I was very fortunate to be introduced to a program at the School of Public Health in international health. Because at Hopkins, I was an international relations pre-med student, and I knew I wanted to do medicine overseas, but I wasn't quite sure what that would look like. And so I ended up in the right place at the right time and discovered this entire field of international health while I was at Hopkins, and pursued a master's in public health at Hopkins in international health, and have worked in global health since. While I was working in global health, I took a bit of a detour and worked for a .com in New York for a little bit. And while I was working for the .com, I had a mentor who approached me about potentially doing my PhD. And so she, came to me, she said, I'm writing recommendations for you to do your PhD. Let me know where you would like me to send them. And I had never thought about doing a PhD before. But because I was working for a .com, I was very intrigued by the idea of what if we could apply technology in a systematic way to global health. And so I applied to Johns Hopkins as well as to the London School of Hygiene and Tropical Medicine. And the London School had a science and technology studies sociologist on faculty who, when he saw my application to look at technology and health, and especially mobile phones and health, he was over the moon. And
he's like, you are coming here now.
Which was awesome. And then the rest is history. I've had a great career in technology and health for the last 20 some odd years.
Amazing. Oh my gosh. I have to go back here for a sec and we'll come back, but gosh, your mom was really a pioneer.
She was. And at a time when there weren't very strong images or masculine images of technology. And so in the 1980s, to be a woman working in technology was not uncommon. I don't know if you've seen the film Hidden Figures, but a lot of the early quote unquote computers were women. They were women who were very good at math and highly detail oriented. And so they were the early computers, and a lot of computer design sort of came from studying these women. And so it wasn't very strange for my mother to have, grown into this field at that time. Unfortunately, in the 1990s, the images associated with technology became very masculine. And so it deterred a lot of women who and girls who might have otherwise just naturally pursued technology careers from doing so. And we're now trying to make up for it by trying to get more girls to pursue science, technology, engineering, and math careers. And it's not easy. A lot of the images that are out there are just not helping the situation.
Yeah, that's so interesting. Now that you say that, Patty, the puzzle pieces come together for me, but I hadn't really thought of it that way. It's curious to try to understand. This is a whole nother podcast and conversation, right? Like, how did that shift happen, right, into the 90s? Like, who was controlling that narrative? I often hear you have a 10-year-old son, right?
Yes.
Okay. And so we talk a lot about young women in school and like, what is that age where girls start to become maybe self-conscious of maybe how smart they are or what career paths they should choose. And like, I wonder how much school and what's happening there and teachers play a role in girls deciding, hey, I'm smart, I'm going to go the science route, in the 90s, right? Versus, I should go a different direction and I'm embarrassed that I'm this smart or, whatever it is.
Absolutely. Absolutely. And I think it happens very, very early on. I think the images that kids are exposed to shape how they approach their lives. I remember Gabriel, my son, when he was 4, he told somebody in front of me, which I thought was the craziest thing in the world. He said, my mom's a scientist. She helps people solve problems. And I don't even know who said that to him, but I wanted to hug him.
Yes.
You're right. I never describe myself as a scientist, but I am a scientist. And a lot of my work in public health is towards helping people.
Yeah, that's so cool. That is really, really awesome. Well, we'll have to unpack that mystery at another date, but I want to get back to your career path. So let's see, where did we leave off? So you were you working when you, when you went to do your PhD? Tell us about how that transition was, that happened.
Yeah, so I've worked pretty steadily throughout my studies, and so while I was doing my PhD, I had helped start a global AIDS program under the Clinton administration, focused on engaging religious leaders and multi-religious response to the pandemic, because a lot of people in sub-Saharan Africa, where the pandemic was, or the epidemic was the strongest, were very interested in having their religious leaders be engaged in addressing HIV. And so we worked with Muslim leaders, with Christian leaders, with Buddhist monks throughout the world to help them engage with their communities in, education related to HIV prevention, and getting tested and treated, et cetera. And so at that time, I was working for CARE, and I had the good fortune of being able to continue to work on that project alongside my PhD, looking at mobile phones and health, and that was just a fantastic experience, because I could already start to see, even through my work with CARE, where mobile phones, could have a really important role to play in increasing access for people to health services and health information, even at a time when, a lot of the penetration rates of mobile phones in countries was around, 3%, 4%, and really hadn't taken off.
Yeah, because that was back 2003, 4, 5 timeframe, based on what I'm seeing on your timeline. So that was early on as far as mobile adoption. But it's my understanding that a lot of countries were even, adopted mobile more so than the U.S., or more quickly than the U.S., because that's all they had, really.
Absolutely. And it was an exciting time. I think no one could have anticipated that mobile phones would become what they are now.
Yeah.
And so at that time, it was still very early days. There's a lot of really fun experimentation on what we could do with them, including examples of animal health experts using mobile phones to track, outbreaks in animal populations and that sort of thing. So a lot has evolved since.
Yeah, absolutely. So I know you spent quite a bit of time at Columbia University. Tell me about your work there.
Yeah, I have to say, throughout my career, it's been incredible how much it's been about being at the right place at the right time. But I had the good fortune of someone sending my CV to Jeffrey Sachs at the Earth Institute at Columbia at the exact time that they were setting up this collaboration between the Millennium Villages Project and Ericsson, the cell phone company, to do mobile phones for health, education, agriculture across the Millennium Villages Project, which was in 10 countries in Africa. And so I was approached by Jeff to see if I would help design that program, lead that program, et cetera. And it was such an amazing experience, just having finished my PhD and then looking for an opportunity to apply what I had learned, through my research on cell phones and health to real world situations. And so did that with a fantastic team at the Earth Institute, and then working with the various teams across different countries. And so we had a relatively large program in Uganda, in Ghana, in Kenya, in Malawi. And so including, there was a program that we helped design in Ghana to do mobile telemedicine. And this was in, I want to say, 2008. That then, because we had included a very strong research component to it, eventually became standard practice in Ghana for telemedicine. And so it's now been scaled in Ghana. And so the like our small project, to do mobile telemedicine in 2008 now continues to exist, but throughout the country.
Wow, amazing. Incredible work. And what an experience. I mean, just to not only pave a way in the industry, but I'm sure what you've seen, I'm assuming you were, on the ground in a lot of these situations, getting things implemented. What an incredible experience to see the world.
It was. And there were a lot of things we learned through both success and failure. I think at one point we had a project in Senegal where they had pregnant men registered in the database, and we weren't quite sure what was going on. And it turned out that there was a glitch in the code, and fortunately we could just update the code, and there were pregnant women in Senegal.
Oh my goodness. Wow. So interesting. So from there, it looks like you went on to do work with the United Nations Foundation.
I did. And while I was at the Earth Institute, there was a convening by the Rockefeller Foundation in Bellagio, Italy, which is beautiful, where it was the first time ever that they brought together individuals from mobile phone companies, from different UN agencies, from NGOs that were starting to experiment on the use of mobile phones for health. And at that meeting, we decided that there needed to be some sort of body or entity that could help bring together the different stakeholder groups around this new emerging field called mHealth. And so through that meeting, the mHealth Alliance was created, and I helped serve on the steering committee for the Alliance while I was at the Earth Institute, and then was invited to become the executive director of the Alliance. And so that's when I went to the UN Foundation, which was incubating the host organization of the mHealth Alliance. And that was probably my first entry point into collective action, organizations, groups, etc. And since that experience, that is something that I have, continually been focused on throughout the different projects and the work that I do. And so there, the idea was that for mHealth to succeed, no one, organization or type of organization could do it all. And so we all needed to work together, set a vision, and then each group or company or organization would bring their strengths to, contribute to that vision. And it was really exciting to see how much we were able to accomplish as a 300 member alliance, over a very short period of time. And so we went from, a question of should mHealth be a field to, okay, mHealth is now a field. How do we do this? and which is very exciting. And then the question shifted as well as mHealth became more integrated with e-health and telemedicine and other technologies, and evolved into what is now called digital health. And so even that evolution, really came to be because of a lot of the collective efforts of some of the major organizations and donors and countries that took the risk and started to design and implement large scale integrated technology solutions for digital health.
Yeah, and not to skip ahead too much, but I'm sure the pandemic also accelerated some of this work just even more recently.
Absolutely. And for countries that really struggled with doing technology at scale, the pandemic forced them to get it together and really figure it out. And so now countries have really good muscle memory. They've done it. They've implemented disease surveillance systems for for COVID-19. They've implemented vaccine tracking systems. They've implemented systems to detect disinformation and misinformation and respond to, vaccine hesitancy issues, et cetera.
Yeah, absolutely. I want to jump ahead a bit. Your time working with the Personal Connected Health Alliance, but before I get there, I also want to note you've obviously taught as well, visiting professor and adjunct both at Johns Hopkins and then, of course, Princeton University. How was that to go back to sort of your roots of where you grew up and teach?
So I actually didn't teach at the School of Public Health at Hopkins. I taught at the School of International Affairs, which is very different, but again, like a wonderful experience because what I was teaching was technology for development, and so not necessarily technology for health. And I think the interesting thing there is that health as a sector, even though a lot of times people in the health sector don't feel like we're that far ahead. Mm-hmm. We're further ahead than the education sector in a lot of low and middle income countries in our use of technology, and we're further ahead than agriculture. And so oftentimes in development programs, folks will come to the health people and say, okay, how did you do this? And so I ended up teaching at the School of Advanced International Studies at Hopkins, but I'm actually now getting instated at the School of Public Health at Hopkins, and so we'll be starting to work at the School of Public Health in the next few months, which will be very exciting.
Awesome, that's great, wonderful. Yeah. Well, I obviously want to get to some of your current projects, current work, to anything you want to touch on at your time with the Personal Connected Health Alliance.
So that was a really eye-opening experience in the sense that, it was sort of the next chapter of the mHealth Alliance and moving away from technologies that were more within, the health systems as well as hospitals, and really thinking about us as individuals. And to me, the ultimate, of public health is getting people to take a much more active role in their health. And so the Personal Connected Health Alliance to me it's probably one of the most fun roles that I've ever had, in the sense that it really brought home this notion of we as individuals need to get much more active in how we use technology in our day-to-day lives to better track our health, better inform decisions that we make from a health perspective, and then better interact with the health systems that are meant to support our care. And so that was, defining what personal connected health was, and then helping to build a coalition around it. Again, that collective action kind of component was a lot of fun.
Amazing. And of course, Health Enabled, your company over the last almost 9 years. You've accomplished so much there. I mean, the Global Digital Health Index sounds incredible, with the World Health Organization, Digital Health Resolution. You've been up to a lot of things with this company. I talk about some of the favorite things that you've worked on over the last 8 years.
Sure. Yeah. So the Health Enabled really evolved out of the unfinished business of the mHealth Alliance. And there, a lot of our focus has been working on the unsexy bits of digital health. Basically, it's the stuff that everyone needs, but nobody really wants to do. So it goes back to the whole collective action, collective impact piece. And there, some of the big initiatives that we have worked on have been things like, the National Digital Health Strategy of Nigeria, and the Global Digital Health Index and Maturity Model, and really thinking about, are there standard metrics that we can use as countries to not only just measure performance over time, but celebrate our achievements by documenting them, and then also identifying where some of the blind spots are and where some of the common challenges are, so that we can work together to try to fill in some of those gaps. Most recently, we've been doing a lot of work with Gavi, the Vaccine Alliance, on their digital health strategy, and kind of testing that across different countries. I was recently in Cambodia and had the good privilege of working alongside the head of the National Immunization Program and their head of their digital health program, and UNICEF and WHO, and among others. And it was really amazing to see, even in this short period of time, just how much the field has matured and how much more strategic countries are becoming in how they're choosing to apply technology to solve their health issues.
Wow. And some fiction writing. Talk about that. How did that come about?
So the fiction writing, and it's funny because I forgot that as a child, I wanted to write children's fiction, and until very recently, and something reminded me of that. But I started writing fiction about 6 or 7 years ago, when I was transitioning out of the M Health Alliance and into Health Enabled. I had an opportunity to go back to the Rockefeller Center in Bellagio, Italy, and do a fellowship. And while I was there, in my fellowship class was at the New York Times bestselling YA writer, Ruta Septis. And she, in listening to her talk about her career transition from being a music producer with her own record label to writing fiction, I was sort of like, well, I've always wanted to write fiction.
So cool. But not just any fiction. I mean, you're tackling sexism, racism, school shootings, anti-vaxxer.
Right.
Like, this is not, just romance novel kind of stuff.
No. And what's more and more interesting is that the more I've written, the closer I've actually come to the work that I do. And so people always say, write what you know. And I think it is very, very true. And so the first the first novel, which is still not published, that I wrote was a public health thriller called Viral, that is actually happening right now, which is crazy because of the resurgence of polio. So in the novel, it's a bioterrorist threat that reintroduces polio because of the anti-vaxxer movement.
Wait a minute, are you like a psychic? I mean, what's going on here?
And so that one was like, okay, and so I need to do something with that at some point. But for now, my latest project, which is coming out on October 4, which I'm super excited about, is the Antidotes Pollution Solution, which is the first in a series, the Antidote series, of middle grade fiction books. And this one in particular came out of a conversation that I had with Gabriel early on in the pandemic, where we both decided that if kids were in charge of the pandemic response, it would not be such a crazy mess. And so
that doesn't sound like fiction, Patty.
So we decided that it would be really fun to write a book about a group of middle grade kids that stop a pandemic before it starts. And that's what we did. So we collaborated on creating the characters together, the story together, and really came out with a book that I'm really, really proud of and very excited to see kind of get out into the world, especially in science programs, as well as in libraries and schools in general. And so there's a lot of really important themes that the book covers, including girls in STEM and encouraging boys and girls to work together, in the sciences at very young ages, so that they know what that looks like as they grow up, and it doesn't become this very foreign thing when you have grown-ups trying to figure out how to work together effectively on teams. It also there's also an animal human disease component, and so there's a plastic eating bacteria experiment that goes wrong and starts to make fish and kids sick, and so the kids get together and they work together to try to get other kids to use less plastic, as well as testing their water sources to really understand the importance of clean water, and as a public health, a basic public health concept.
Awesome. I love it. And I recognize Bold Story Press coming out October 4th on Amazon.
Yes.
2022, the Hera Hub collaboration.
Absolutely. And it was Julia Westfield who introduced us to each other. So the head of Hera Hub DC put the two of us together. And so, and it's been a wonderful collaboration.
That's so great. Okay, so what's the next book? I know you said it's a series.
It is a series. And the next book, the working title is called Masters of Technology. And it is the same group of kids, the Antidotes. And one of them develops a computer algorithm that gets taken by a company and put out into the world, and it starts wreaking havoc. Mm-hmm. And the kids have to learn how to become critical users of technology and critical thinkers about technology to stop the damage that it causes.
Wow. Cool. I can't wait to read it. And hopefully it sounds like it might be, again, I know you're writing fiction, but these sound like it might be some interesting thoughts to look at for nonfiction as well. So really amazing work. And if folks want to find you, Patty, I know you've got a separate Instagram for the book series. Do you want to rattle that off for us? Sure.
The Antidote series on Instagram. And then you can reach out to me through my website, Patricia Mechael, Mechael.com.
Awesome. Thank you so much for your time, Patty. I have learned a lot and really enjoyed our conversation.
Me too. Thanks, Selena.
Thank you for joining this week's episode of Flight Club, sponsored by Hera Hub. We look forward to sharing more success stories with you soon.